Hello, everyone, and welcome to the impromptu lecture over the healthcare assignment and the healthcare system in America at the current time, and the problems there with it. So to begin on the basic research, like how do we conduct basic research for background material, I'm going to go over first off that you need to know what the policy is currently if you're going to end up changing it or trying to affect it in any way. So the biggest question is what's wrong right now, what's going on right now, and how do I find that in a summary kind of form, right? So the best way to do it, like I mentioned before in class, is you go to like the Brookings Institute or the Cato Institute. So Brookings, for example, go to Brookings. Here we are. Search for healthcare, right? Boom. Possible topic. There you go. And it'll say the need for reforms in healthcare. Healthcare is major demise of major mergers. India healthcare, U.S. healthcare. Any of these would actually work fine. So let's go with the need for healthcare reforms and finances. It turns out that's not American foreign policy. That's not American policy. It's foreign policy. So let's check here. Boom. Okay. Cool. So here's a list of resources as well as the content that are related to this. These are all sources you can use to get the background on it. So this one, for example, how has the ACA affected state healthcare, is a good link because you're going to get individual background status of what is going on in the individual states in the marketplace currently. So for example, summary report, click on that, boom. Downloads, inshallah, a summary report about the ACA marketplace competition. And here's the state analysis team, where it was conducted, the states that are included, there's a whole research portfolio done for you that has all the background for the insurance market and the ACA in these states. So that's a great place that I think everybody should start if you're dealing with the insurance market or any kind of state-based healthcare as part of your proposal. It'd be essential that you look at what's going on right now in the state and the federal market, right? All right, here's the same thing as the Texas proposal. So if you're interested in that, stats from that, there you go. Same thing with California, et cetera, et cetera. It's all available on Brookings. Now, the question then is, what do you do once you have this basic research and know what's going on with the healthcare system right now? How do you pick a topic? So you can't very well, or if you can, try to fix the entire thing from the ground up. That'd be lovely. But no one's been able to do that thus far. And so knowing the parts of the system that work together or are more problematic than others will help with the eventual crafting of a policy, right? And this is where the assignment sheet comes in and the tasks for the group begin, right? So recognizing the problematic conditions, identifying the problem they create, right? So the first condition, or the first, myth I'll bust, is that the provision of care and the provision of insurance are not the same thing. So you have in the Affordable Care Act, the government was not providing health care to people. It's access to care through insurance the government is trying to subsidize. And so there's an issue then within the rhetoric of healthcare being a human right, which let's say is a positive right, and we're good with that. But how is the government going to provide that with the legislation that's passed? Does the government actually provide access to care, which is the right apparently, or is it merely the ability to have subsidies to help pay for care once it is accessed? And if this is the case, then how do we claim solvency on people not getting health care and then getting it after the plan? So in any kind of plan that's going to address health care, needs to address health care and not health insurance, right? Not access to care, paying for care, but how are people going to be guaranteed their human right to care? And so this is where we want to kind of attack the policies that exist as well as build upon for our own proposals, right? It's like, how do we actually make it so the right of health care is a thing, right? How can we make access to it not contingent upon the doctor's whims, more or less, or the ability to have copay or to have insurance cover the amount of the procedure being done. So here's the big deal and breakdown with that, right? Is that when you have insurance provided by the government or subsidized by the government, as opposed to having care that's covered by the government in its entirety, is that you have a system where, for example, Medicaid, Medicare, the Peach Care, the state Medicare, Medicaid income-based programs, all reimbursed at like a third of the at 33 cents to the dollar, more or less. Medicaid federally is down, it's like 48 cents to the dollar. So doctors are getting paid half of the amount that are getting paid from patients who have private insurance from the government subsidies and the government insurance income-based insurance programs. So because of this, the doctors are not incentivized to take any patients who carry these insurance coverages. So you have doctors who are opting out of taking patients because it's financially not beneficial for them to take the patients, right? And so because of this, because it's only an insurance prop-up and it's helping to pay at a reduced rate, there's no incentive for the doctors providing more care. So not only that, are we not only like de-incentivizing the labor force, we're also making it so there's a shortage of care practitioners and care givers in the labor market, right? Because as the number of doctors is even on the decline annually, we also have the issue that there's more and more restrictions from the AMA and the FCC and the FDA that governs who can issue what kind of examinations, who can give prognoses, who can prescribe certain drugs, and that's constantly being rallied against and put more regulations on the books. And so because of this, the individuals who can actually treat or actually give the kind of care level needed are growing smaller, and the demand for access is going up. And so there becomes a shortage of the actual people who can provide the care on the high levels in prognosis and prescription drugs, but actually a surplus of individuals who can do triage care. So a plan that we can look at with that, with the labor shortage and the division of tasks, could look at maybe expanding the rights and the responsibilities of CNAs, of registered nurses, of charge nurses, or different kind of grading of pharmacy techs and pharmacy doctorates to include prognosis and prescription of pharmaceutical drugs. That would improve access by increasing the number of providers in the system. So these are the kind of things we could think about when we're looking at aspects of the system to deal with, right? Now, the whole thing at once is probably not going to be a feasible idea, but to do the provider shortage, to do incentives for doctors and nurses going to college for those programs, to look at regulations from the AMA being repealed, or different standards for the AMA that are exclusionary to some practitioners being lessened, like letting folks pass a test if they have an MD or a nursing doctorate from outside of the country and transfer it into America. Currently have to go through reschool and recertification. They could fast track that. There'd be another reason to, or another way to increase the labor supply. And so they could avoid that financial de-incentivization and the pitfall of the reimbursement rates being low from the federal government.